If you have a positive COVID-19 test, you might be wondering how to get the monoclonal antibody treatment. Well, you come to the right place. I'm going to tell you how to do that right now. So let's get started.
We worry a lot about what we don't know, but there are things that we do know also in this space. The truth is that what we're seeing is that the disease itself is doing horrible things to moms and their unborn kids.
If you have symptoms of COVID-19, the first step is to get tested as soon as possible. Experts are recommending a COVID test about 4 days after an exposure if you do not have symptoms. Now, you can find testing locations at the link in the description below, or you can go to any local pharmacy and the testing is usually free. And ask your doctor, are you eligible to get the monoclonal antibodies? So here are the conditions that should qualify you to get the monoclonal antibodies. Now, the rules have changed with the monoclonal antibodies so far as it has to do with can they be given, how close they can be given to when you're vaccinated, and before you couldn't, pregnant women couldn't get them. This is Dr. Anderson from the University of Colorado, and he was interviewed by the American Medical Association. Here is what he said in his interview.
Up until November of 2020, physicians were faced with a terrible dilemma. A patient had turned positive for novel SARS-CoV-2, but wasn't sick enough to be hospitalized. And all we had was really hope and prayer. Now we have three EUA-approved monoclonal antibodies that have shown to be effective in this particular group of patients. They're symptomatic. They've turned positive for novel SARS-CoV-2, but thank goodness they are not sick enough to be admitted. And the EUA criteria for exactly who those patients are has changed. We'll talk about that in just a minute. The science is pretty straightforward. These are exogenous antibodies aimed at novel SARS-CoV-2. They bind the spike protein, and they basically are an interim step until the patient can recover, generate their own antibodies, and of course, vaccine has really been life-saving. So they bind to the spike protein, that then destroys the virus and provides, I think of it sort of as a bridge until the patient's own immune system can kick in, hopefully via vaccine, and then the patient is then recovered. No earlier is better. That the EUA says within 10 days of symptoms, but we've seen in studies coming in over the past several months, the earlier the better. Now the EUA criteria has changed. This is sort of breaking news with monoclonal antibodies. And as we sit here in June of 2021, a lot of things have changed as well. But there's certain high-risk patients that really need to get these therapies as soon as possible. The elderly, patients with pre-existing conditions, and recently the FDA changed and added a couple of things. Number one, the definition of obesity went down to a BMI of 25. Number two, they added pregnant women to the high-risk category. So pregnant women now qualify for these therapies. And the last line is specifically, or I should say really important for clinicians. And that is the FDA says, you as a clinician, you as the physician taking care of this patient, think that the benefits outweigh the risks. That to me says two things. Number one, it really gives clinical judgment back to the clinicians. And number two, it says these are really becoming part of the fabric of everyday medicine. And you doctors, you tell us if you think this patient can benefit from these therapies.
So monoclonal antibodies are a great tool that we have now for COVID-19 treatment. So I would encourage you to ask your doctor about that. And if you don't have a doctor, contact the monoclonal antibodies call center or chat with them at the link in the description below. Here's what Dr. David Tharacher has to say about monoclonal antibodies. He is a medical doctor here in Alabama.
I tell people, if you are positive, call your primary care doctor, your provider, whoever it is, and say, do I qualify for the monoclonal? They may say, well, I don't know anything about it, or you don't qualify. They say you don't qualify, ask for why. Okay, because I say if you're over 12 years old and you can walk and talk and live in Alabama, you probably qualify. The qualifications are very, eligibility requirements are very broad. If your doctor doesn't know, I'm going to say call your local hospitals, and hopefully they'll have somebody they can you can be referred to. You get to the hospital, I don't have a lot of bullets in my gun. If I can get you early and keep you out of the hospital, that's our best bet. Once you're in the hospital, I've got steroids. Well, I got steroids as an outpatient. I've got oxygen in the hospital. I got oxygen outside the hospital, not as much like a ventilator, but I got a few other things. We won't talk about Actemra and Illumient and some other ones, but they aren't great. Okay. And once you're that sick and your oxygen level starts falling, I'm behind the 8 ball. Okay. So I really want to get you before you get in the hospital. So most people will qualify, and you really want to encourage them to be proactive. Now, basically, if you've been infused, wait 30 days. If you did not get the infusion, probably about 10 days after you are afebrile, you can go ahead and get the vaccine. You don't have to wait 90 days for that. Well, you put an IV in, you hang the bottle up, and in 20 minutes it goes in, it takes it out and watch it. That's it. It's not a big deal. It's a 20-minute infusion. We watch it for an hour, and it's incredibly well tolerated. And we also just got approved for the subcutaneous. That's where you make a small injection in your leg or your arm, and we go roll those out to rural doctor's offices that want to give it. If you've been exposed, now don't go run out the next day and get a test, because it may be false negative. You know what I say, what I'll do, I will kind of quarantine myself for 4 days. I can get tested in 4 days, but don't get tested before 4. We used to say 5, but this is so contagious, usually 4 days. Now, if you start having symptoms, you get tested then. But if asymptomatic, wait 4 days, or you may be fat and happy and think you don't have it, and you do. I got vaccinated. Before, it takes about 6 weeks to get fully protected when you're vaccinated. We have a lot of breakthrough infections in that 6 weeks. Yes, I'll go immediately infuse them and then wait 30 days for their second shot.
That's all I have for you today. Stay tuned to Mother Baby Daddy, where I'll tell you everything you and Daddy needs to know about having a healthy pregnancy and a healthy and happy baby. Thanks for listening, and I'll see you in the next one.